So, Mickey, how are you doing today?
Doing good.
Yeah? Any restrictions or anything I should know?
Yeah, I slept kind of weird last night, so the right side of my neck, I just noticed looking over my right shoulders kind of decreased, and I'm noticing kind of tension right around my C7, and it's kind of going up all the way into C1, C2, so kind of right in the neck area,
Okay.
especially on the right side.
Okay,
Other than
excellent.
that, doing good.
All right.
Yeah.
Oh, yeah.
Yeah.
So most of the lateral flexion takes place in the lower cervical spine, so exactly what she's saying here.
Yeah.
Not really shoulder checking that well. Not much rotation. Way better on this side.
Yeah.
And way better there. Yeah. So why don't we start with the cervical spine then? I'll get you to lie on your back, please, face up. So I'm just going to do a little bit of palpation here. Get in. A little restricted in there?
Oh.
Yeah, you feel that right away. Yeah, not so much on this side.
Yeah.
Okay, so if I just go through, depending on the patient, some patients will do manipulation, other patients in the cervical region will just do mobilization. Mobilization will go through range of motion and just feel the restriction is in the joint. For other patients, they find it more effective to get the joint manipulated. And I'll just show you in just a second here. Okay, and yeah, that's just not going, is it? All right, I'm going to take a look at this side first. We've got some stuff over here. Just relax the shoulder. Thank you. Okay, take it down here. Good. So we only use as much force as we need to get some motion in the joint. But we're restricted up here. There we go. So as you see, you've got full range of motion here. Let's take it into lateral flexion. The head goes right over now. Good,
Wonderful.
excellent.
Oh.
Good. So the next region I'm going to address is thoracic spine. Have you been having any problems in terms of breathing lately, or are you feeling any respiratory issues going on? Or
No, that's been pretty good actually.
yeah, how about the junction between the cervical spine and the upper back here? Has that been tight on you lately,
Very
or?
tight, yes. More
Very
computer
tight.
work lately.
Okay, all right. So we're probably going to have to address this in two different ways, with you face up and face down. But let's take a look at face up first. So I'm just going to bring your arms up here, and I'm just going to palpate in here. Oh, you're pretty tight up here.
Yeah.
Okay, let's work our way down. Oh, that's not very
Oh.
super tight there, isn't it?
Yeah.
Or do you know that was there?
No.
All right, so now just get you, I'm going to just get a little traction here, roll you back onto here. There we go. One more time. There we go. And again. There we go.
Oh.
Perfect. Okay, I think that released quite well, actually.
That did really good.
Okay. So let's address some restrictions in the lumbar spine. Mickey, I'm going to get you to actually lie on your side towards me, please. I'll just bring your leg up here. I'm going to bring you over a little bit to the side. And see your arm, bring you in there. You okay?
Yep.
Okay, I'm going to roll you forward this way, and I'm just going to get on the SI joint here. Move over a little bit. There we go. Good. You okay?
Yes.
Other side. Even though this side wasn't as restricted, we could still have a problem here. We could also get the lower lumbar spine, the sacrum to actually shift over. So it's really important we address both sides. Down. There we go. Good. So some of the common things we do when you come in for adjustment is also take a look at some of the other joints in the periphery of your body. So I'd actually get in and I take a look at the shoulder and see whether or not that was restricted. Take a look at the sternoclavicular joint, look at the AC joint. And if I found a problem there, then I get in and I actually mobilize that. I get on the elbow, try to look at the head of the radius here and see whether or not it's actually moving the way it should. And just get some mobility in there. You okay?
Mm-hmm.
Get on the wrist, kind of work my way around there. Those are tight.
Yeah.
Okay. Open that up a bit. There we go. How's that feeling?
Really nice.
Good. Okay. We carry a lot of restrictions, and a lot of those restrictions are both osseous joint restrictions or soft tissue. So you kind of have to address both. Okay. Good. Doing okay?
Oh yeah.
Good. And we'll just release that. And obviously I would go and I would address any restrictions on the opposite side on the other hand. Of course, if we're going to address restrictions in the feet, I'm also going to take a look at the hips and see whether we have a restriction there. I would also look at the joints around the knee and manipulate that if I found a restriction on either side. But one thing that's commonly missed is actually looking for restrictions in the feet. So I'm just going to get in here and kind of take a look at the heel bone here, the calcaneus, make sure that that's moving okay. That's not too bad on you. Get up and look at some of the other areas in the feet, navicular. Push your toes. There we go. Big toe. Well, I better close both sides, otherwise it's going to feel really strange when you stand up and walk. This is one area where people really appreciate being worked on because we hold a lot of tension in our feet and we do not even realize it. Good. Okay, I'm going to have you stand up, Mickey, move around a bit and just see how you feel. So how's that feeling?
Really good. Everything feels kind of like there's extra movement around my breathing. I didn't realize my breathing was actually restricted, especially that mid area in the back.
You had a really tight area there.
I had no idea.
Move your head around from side to side.
Like that's, I can actually look back.
Now you can actually just shoulder check there.
That too. Like I couldn't do that this morning.
Try the other side there. Yeah. That's good. Yeah.
Like I couldn't do that this morning, and I didn't. You kind of don't really appreciate your hands until somebody really gets in there and you realize how much stress is kind of kept up in there. So that's really nice.
Excellent. Well, no, you feel a lot better now.
Yeah, definitely.